Using yellow enhancement for easier identification of surgical planes and structures for a difficult high anterior resection in an obese patient. Yellow enhancement mode is a new laparoscopic imaging feature that enhances structure identification during minimally invasive surgeries. The yellow enhance image processor shifts certain colors to yellow, resulting in increased contrast between structures. We present a case where yellow enhancement was used in a high anterior resection in an obese patient. Yellow enhancement was used in the identification of surgical planes, blood vessels, nerves, and ureters in order to minimize bleeding or other accidental injury. Firstly, on the identification of planes and blunt dissection. This video shows the increased contrast of color between the yellow adipose tissue and the non-adipose avascular plane, which is the interface between the visceral and parietal peritoneum. While it is possible to identify this plane without the enhancement, there is a clearer distinction of the transition zone with it, allowing for more precise dissections. Here we see a clear distinction between the avascular plane and the two fatty tissue. This enhancement allows for dissection closer to the bowel wall, resulting in lower risk of injuries to other structures/vessels. Misrecognition of planes can result in visceral, vascular, or peritoneal injuries or bleeding in obese patients who typically have thickened mesentery with more adipose tissue. Therefore, having an improved visualization and distinction of surgical plane is helpful for more precise dissection and reducing blood loss. Without yellow enhancement, one might dissect along the red dotted line, which may not be ideal when compared to the clearer lines of dissection identified with the usage of yellow enhancement. Next, on the identification of vessels, to minimize bleeding. Here, we see the tracing and clipping of the inferior mesenteric artery. We can see here the distinction between the color of the fatty tissue and the inferior mesenteric artery. This early identification of non-adipose tissue from adiposity prevents accidental injury to critical structures like vascular pedicles, which can happen more in obese patients compared to non-obese patients. While it is again possible to trace the inferior mesenteric artery and clip it without yellow enhancement, the contrast between the vessel and the surrounding fat tissue is not as strong and would appear under white light similar to each other as in a general pale appearance. The yellow enhancement allows clear demarcation of the artery and enabled precise skeletonization and ligation. The upper border of the inferior mesenteric artery is surrounded by fat tissue, and dissection of the region above the artery without causing injury to the artery was made significantly clearer with yellow enhancement, ensuring only the adipose tissue was dissected prior to clipping of the inferior mesenteric artery. An extension of this usage of yellow enhancement can be for the identification of aberrant blood vessels intraoperatively, which further minimizes unnecessary bleeding. Aberrant vasculature concerns have previously come in the way of safe laparoscopic resections in patients with intestinal malrotation. We see the benefit of yellow enhancement in identifying these vessels and making these resections safer for patients with intestinal malrotations and aberrant blood vessels. Finally, here is a short demonstration of the contrast between the small mesenteric vessels against the adipose tissue with and without the enhancement. Now on to the identification of structures to be spared, such as the nerves and ureters. As shown here, the ureter was identified prior to tracing and ligating the inferior mesenteric artery, as injury to the ureters usually occurs when taking the inferior mesenteric artery or vein. In this patient, a lot of adipose tissue had to be dissected before encountering the left ureter. Without the enhancement, identification of the ureters would have been difficult due to the adipositas surrounding it. Here is the ureter in the patient without yellow enhancement, and we can see the ureter is a lot paler and may not be distinguished easily from the fat tissue that may surround it. Other crucial structures that can be identified easily with yellow enhancement are the retroperitoneal hypogastric nerve plexus. The identification of these nerves is made easier, as demonstrated here. The hypogastric nerves were found by blunt dissection of the overlying fascia and fat. The nerves were traced, and a nerve was sacrificed. In this video, we discussed the usage of yellow enhancement for efficient colorectal surgical management of obese patients with fat tissue content high enough to limit exposure and pose a greater difficulty in identification of important structures. It allows greater appreciation of the avascular plane of dissection and is helpful for identification of structures in settings where adequate exposure or retraction may not be feasible. We therefore strongly recommend the use of yellow enhancement for laparoscopic colorectal surgeries in obese patients.